Imagine losing 90% of something vital and not even realizing it is gone. If your heart fails, it gives you crushing chest pain. If your lungs fail, you gasp for air. But if your kidneys fail, they suffer in almost total silence. By the time you feel the first real symptom, you may have already lost up to 90% of your kidney function. That damage is often permanent and cannot be reversed. Every single day, your kidneys filter about 200 quarts of fluid. They are the unsung heroes of your body's survival. Yet chronic kidney disease currently affects over 37 million adults in the United States alone. And here is the most shocking part. 9 out of 10 people who have it do not even know it yet. Today on Physician's Desk Guide, we are pulling back the curtain on this silent killer. We will walk through 8 silent signals your kidneys may be sending you right now. These are warnings that your body may be quietly drowning in its own toxins. Please do not ignore these signs. What you learn in the next few minutes could genuinely help save a life. The master filters inside your body. Before we reveal the signs, you need to understand what is actually happening inside you. You have 2 kidneys, each about the size of your fist. They sit deep in your back, just below your rib cage. Inside them are millions of microscopic filters called nephrons. Think of them as an advanced, around-the-clock water purification plant. They pull waste, toxins, and excess fluid out of your blood. They turn that waste into urine so your body can release it. They also regulate your blood pressure and balance your minerals. They even signal your bones to produce new red blood cells. But when this purification plant comes under attack, the damage begins. High blood pressure, diabetes, and hidden inflammation are the most common attackers. Under that kind of stress, nephrons begin to die off, one by one. And this entire process usually happens silently, without any pain at all, because you have so many of these filters. The surviving ones work overtime. They quietly pick up the slack left by the ones that failed. This is exactly why you can feel perfectly fine while your kidneys are dying. That feeling of normalcy continues right up until the filters can no longer keep up. Sign 1. Changes in your bathroom habits. Ask yourself this question honestly. How many times did you wake up last night just to use the bathroom? Warning sign number 1 is a drastic change in your urination pattern. This is usually the very first whisper of trouble your body sends out. When kidney filters become damaged, they lose the ability to concentrate urine properly. As a result, you may feel an intense, undeniable urge to urinate. This often happens especially in the middle of the night. Doctors call this condition nocturia, and it deserves your attention. But frequency alone is not the only thing worth watching closely. Pay close attention to what your urine actually looks like too. Is it pale and unusually abundant, almost like water? Or is it dark, concentrated, and produced in only small amounts? Most importantly, watch for any trace of blood in your urine. Even a faint pink tinge should never be dismissed as a minor issue. Healthy kidneys are designed to keep blood cells safely inside your body. When the filters break down, blood cells begin leaking directly into your urine. This single sign alone is a massive, glowing red flag. Sign 2. Metallic taste and ammonia breath. Have you ever brushed your teeth and used mouthwash, but a strange taste just will not go away? Warning sign number 2 is a metallic taste in your mouth, paired with ammonia-like breath. When your kidneys fail to filter out waste properly, a condition called uremia can develop. Uremia literally translates to urine in the blood, which sounds as unpleasant as it actually is. As toxins like urea build up to dangerous levels, they begin affecting your entire body. That includes your digestive system and, notably, your sense of taste. Many patients describe ordinary food suddenly tasting distinctly like metal. Meat, in particular, can start to feel nauseating for no clear reason. You may also lose your appetite entirely and start dropping weight without trying. As excess urea breaks down in your saliva, it converts into ammonia. That conversion gives your breath a distinct, unpleasant odor, similar to urine itself. Mints and mouthwash will not fix this particular problem. This is your body's way of signaling it desperately needs a biological cleanse. Sign 3. Persistent, excessive foamy urine. The next time you use the restroom, take a closer look before you flush. Does the bowl look like someone poured a beer into it? Warning sign number 3 is excessive, persistent foamy urine. We are not talking about a few bubbles from a fast, forceful stream. We are talking about thick, multi-layered foam that survives 2 or 3 flushes. Why does this actually happen inside your body? The culprit is a protein called albumin, which normally belongs in your blood. Albumin is essential for keeping fluids safely contained inside your blood vessels. Healthy kidneys act like a fine sieve during the filtration process. They let water and waste pass through while keeping large protein molecules inside. But when the kidney's filtering units, called glomeruli, sustain heavy damage, that sieve fails. High blood pressure and high blood sugar are common causes of that damage. Once the holes in that sieve get larger, protein starts spilling into your urine. When that protein hits the water in the toilet bowl, it foams up. The effect looks remarkably similar to whipping egg whites in a mixing bowl. This single sign is considered a critical indicator of rapidly declining kidney function. Sign 4. Unexplained swelling in your body. Have your shoes suddenly started feeling too tight around your feet? Or do you wake up looking like you have been crying all night? Warning sign number 4 is unexplained. Severe swelling in your extremities and face. Remember that protein we just discussed, called albumin? Its main job is to act like a sponge, holding fluid inside your blood vessels. When you lose large amounts of albumin through your urine, your blood loses that sponge effect. With nowhere else to go, that fluid begins leaking directly into your surrounding tissue. At the same time, failing kidneys struggle to remove excess sodium and water properly. Gravity then pulls this heavy, toxic fluid downward through your body. This causes your ankles, feet, and legs to swell up noticeably. Doctors call this condition edema, and it is easy to test at home. Try pressing a finger gently into your swollen ankle and watch what happens. If the indentation stays there for several seconds, that is a meaningful warning sign. You may also notice severe puffiness forming around your eyes, especially in the morning. In a very real sense, your body is flooding itself from the inside out. Sign 5. A deep, unrelenting itch. Imagine an itch so deep and so maddening that scratching never actually helps. Warning sign number 5 is severe, unrelenting skin itching. This remains one of the most misunderstood symptoms connected to kidney failure. Many people buy expensive lotions and creams, assuming they simply have dry skin. But this particular itch does not actually originate from the surface of your skin. It comes from deep within your bloodstream instead. Healthy kidneys carefully balance 2 important minerals, calcium and phosphorus. When your kidneys begin to fail, phosphorus starts building up to toxic levels in your blood. That excess phosphorus then binds with calcium, forming tiny microscopic crystals. Those crystals deposit themselves in your skin and in your blood vessels over time. The result is a condition doctors call pruritus, an intense, bone-deep itching sensation. For some patients, that itch becomes severe enough to cause bleeding from constant scratching. If you notice constant itching alongside skin that looks unusually pale or discolored, take it seriously. That combination often means your master filters have become severely compromised. Sign 6. Crushing fatigue and feeling perpetually cold. You sleep for 8, 9, even 10 hours some nights. Yet you still wake up feeling like you just ran a full marathon. Why does that keep happening to you? Warning sign number 6 is crushing fatigue combined with unusual cold intolerance. Your kidneys do far more than simply produce urine every day. They also function as an important endocrine organ within your body. They produce a critical hormone called erythropoietin, often shortened to EPO. EPO acts as a messenger, telling your bone marrow to manufacture red blood cells. When your kidneys begin dying, EPO production drops dramatically and quickly. Without enough red blood cells, your body struggles to transport oxygen effectively. Your brain, your muscles, and your vital organs all suffer as a result. This condition is a severe, specific form of anemia connected directly to kidney failure. You are not simply a little tired in the ordinary, everyday sense. Your individual cells are genuinely struggling from a lack of adequate oxygen. This explains that bone-crushing exhaustion many patients describe experiencing. It also explains why you might feel freezing cold even inside a warm room. Your body's internal furnace, in a very real sense, has run out of fuel. Sign 7, shortness of breath that feels like drowning. You are sitting completely still on the couch, simply watching television, yet you find yourself gasping for air as though you are drowning. Warning sign number 7 is unexplained, persistent shortness of breath. This frightening symptom connects closely to several of the signs we already covered. It typically happens for 2 distinct, separate reasons inside your body. First, the severe anemia we just discussed starves your body of oxygen-carrying blood cells. That forces your lungs to work considerably harder just to compensate for the shortage. Second, and considerably more dangerous, excess fluid your kidneys fail to remove keeps building up. That fluid does not stop at your legs, and it does not stay contained there. It can begin backing up directly into your lungs over time. Doctors call this condition pulmonary edema, a serious buildup of fluid in lung tissue. In practical terms, it means fluid is accumulating in spaces meant only for air. If you find yourself needing 3 or 4 pillows just to breathe comfortably at night, please seek medical care immediately. That specific pattern is considered a genuine medical emergency, not something to simply monitor at home. Sign 8, a deep, persistent ache in your back. Back pain is extremely common, and most of the time it is nothing serious. But how do you actually tell a pulled muscle apart from a struggling organ? Warning sign number 8 is deep, persistent flank pain. Most kidney diseases do not actually cause pain at all. That painlessness is precisely why kidney disease is so often called a silent condition. But there are some important, specific exceptions worth knowing about. If you feel a deep, dull ache high up in your back, just below the ribs, pay attention. This pain typically shows up on only one side of your body. That specific pattern is often a genuine sign of kidney-related pain. Unlike ordinary muscle pain, kidney pain does not change when you move or stretch. It tends to stay constant, throbbing, and deep no matter your position. This kind of pain is often connected to polycystic kidney disease. In that condition, fluid-filled cysts slowly stretch and strain the kidney's outer capsule. It can also signal a severe kidney infection that needs prompt treatment. Or it may point to a kidney stone blocking the normal flow of urine. That blockage causes urine to back up and the kidney itself to swell painfully. Please do not simply dismiss this pain as a bad mattress or a workout injury. Your action plan to protect your kidneys. If you recognized any of these signs in yourself or in someone you love, please do not panic. But you should absolutely plan to act promptly and with real intention. Here is a clear, practical action plan to help protect your kidneys starting today. Step 1. Ask for the right tests. A standard physical exam alone is simply not enough to catch this early. You should specifically ask your doctor for 2 inexpensive, widely available tests. The first is a blood test that measures your EGFR, or estimated glomerular filtration rate. That number tells you exactly what percentage of your kidney function currently remains. The second is a urine test that checks your albumin to creatinine ratio. Catching a protein leak early is often the key to slowing this disease down. Step 2. Control the 2 biggest threats. High blood pressure and type 2 diabetes together cause roughly 3/4 of all kidney failure cases. If you live with either condition, managing it carefully is not optional. It is genuinely a matter of protecting your long-term health and survival. Work closely with your doctor to keep your numbers within a healthy target range. Step 3. Take a second look at your medicine cabinet. Common over-the-counter painkillers, especially NSAIDs like ibuprofen and naproxen, can strain your kidneys. This is especially true when they are taken daily or in large doses over time. Always talk with your physician before relying on these medications long-term. Step 4. Hydrate thoughtfully without overdoing it. Drinking enough water helps your kidneys clear out sodium and everyday toxins. But if you already have advanced kidney disease, more water is not automatically better. In some cases, your doctor may actually recommend limiting your fluid intake instead. Always work directly with a specialist to determine your own personal, specific needs. Your kidneys have been working tirelessly in the background since the day you were born. They rarely complain, right up until they are on the brink of total failure. Please do not let their silence fool you into a false sense of safety. By paying close attention to these 8 hidden signs, you gain real, meaningful power. You gain the power to step in before the damage becomes permanent and irreversible. If this video opened your eyes today, please do not keep this information to yourself. Share it with your parents, your friends, and the people you love most. Hit that like button to help this important message reach someone who truly needs it. And subscribe to Physician's Desk Guide for more expert-backed medical truths every week. Stay informed, listen closely to your body, and we will see you in the next video. This video is provided for general educational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. Please consult a qualified healthcare provider about any symptoms or concerns regarding your kidney health.